Hi everyone. My name is Nobuo Peter Oki. I am a university professor in Japan, a surgeon, and I manage a medical center in Yokosuka, Kanagawa Prefecture. I perform over 1,000 surgeries a year and work tirelessly to treat many patients. Today, I want to talk about a condition that is often difficult to treat, bladder pain syndrome and interstitial cystitis, also known as BPSIC. Understanding BPSIC. BPSIC is a chronic condition characterized by pelvic pain and urinary symptoms that significantly affect the quality of life. However, the symptoms vary greatly among patients, making it challenging to diagnose and treat effectively. Many people think BPSIC is only a bladder disease and focus treatment solely on the bladder. This is a big mistake. BPSIC must be viewed from the perspective of the entire pelvis. Illustration: PCA clustering overview. Let's start with a graph that explains the clustering of different BPSIC subtypes. This graph uses PCA, or principal component analysis, to visualize our data. Each point represents a patient, and the colors indicate different clusters. The yellow crosses mark the center of each cluster. Explanation of PCA graph: Cluster 0, these patients experienced severe bladder pain and frequent urination. Cluster 1, this group has inflammation in the ligaments between the cervix and bladder, known as pelvic floor pain syndrome. Cluster 2, this group is characterized by vulvodynia, which is pain in the vulvar area. These patients have less frequent urination symptoms but benefit greatly from vaginal laser treatments. Illustration 1, Anatomy Overview. Now, let's look at an illustration to understand the anatomy involved. Here you can see the bladder, uterus, vagina, rectum, and anus. This basic understanding is crucial for discussing the different subtypes of BPSIC. Illustration 2, Cluster 0, Bladder Pain Subtype. Next, we have an illustration depicting Cluster 0. This group has inflammation in the bladder's interstitial tissue, traditionally known as interstitial cystitis. Patients in this group experienced severe bladder pain and frequent urination. Illustration 3, Cluster 2, Vulvodynia subtype. Moving on to Cluster 2, this group is characterized by vulvodynia, which is pain in the vulvar area. The inflammation here extends from the vagina to the urethra and bladder neck. As a result, these patients have less frequent urination symptoms but benefit greatly from vaginal laser treatments. This is one of the subtypes of bladder pain syndrome. Illustration 4, Cluster 1, Pelvic floor pain subtype. Finally, we have Cluster 1. This group has inflammation in the ligaments between the cervix and bladder, known as pelvic floor pain syndrome. This newer condition responds well to treatments targeting the cervix and vaginal laser therapy. Conclusion: as you can see, clustering helps us understand the various subtypes of BPSIC and provides a clear direction for treatment. Each subtype has unique characteristics and responds differently to treatments, making personalized care crucial. Final thoughts: thank you for watching. If you found this information helpful, please like and subscribe for more updates on our research. And remember, if you are experiencing symptoms of BPSIC and bladder treatments alone are not helping, consult with a healthcare provider for a thorough evaluation and personalized treatment plan. Stay healthy and take care. Feel free to adjust the script according to your style and preferences.